The humanitarian crisis in Gaza is deepening. Hospitals are overrun and basic supplies to treat the wounded have or are near running out. Is there any hope for the territory's devastated healthcare system? Hello and welcome to Roundtable. I'm Enda Brady. Now, aid convoys are now trickling into Gaza, but it's a drop in the ocean of what's needed. Time is running out and lives are being lost. So what can be done to help the people in the territory?
The situation should never have reached this point. Not like this, not to this extent. Small children are dead. The children died.
Nadia is at breaking point. She's a nurse at the Al-Aqsa hospital, arguably the biggest in Gaza. The plight of medical staff and wounded civilians was brought into sharp focus after the unimaginable attack on the Al-Ahli hospital last week, resulting in hundreds killed and wounded. The medical facilities that are still able to operate are running out of basics. And now many fear power supplies could end as fuel for generators runs dangerously low. The first convoys have finally crossed into Gaza from Egypt, but it's a fraction of what's needed.
But in normal time, without war, 100 trucks enter into Gaza every day. So it's clear that 20 is not enough.
The World Health Organization has indicated this situation comes down to human dignity.
We get sick, we get hurt if we crash our car on the way home. All of that will be available to us and not available to any man, woman or child in Gaza tonight who is injured for any reason.
Before the war, Gaza's healthcare system was in a steady decline following years of Israeli and Egyptian blockades. The UN agency operating in the region says the sector lacks infrastructure and training, while facilities are overstretched and plagued by frequent power cuts. Over 90% of water in Gaza is not fit for human consumption. As the death toll in Gaza continues to climb, these children are writing their names on their arms. That way, if they end up in an attack, a hospital, or a morgue, at least their bodies can be identified.
Earlier, I spoke to TRT World correspondent Nizar Sadawi, who's been covering the conflict from Gaza. He told us how desperate the healthcare situation is there. Please begin by just spelling out the conditions medics are working under in Gaza's hospitals.
The situation here is absolutely catastrophic, actually. It's been hectic here for the past 18 days, and it seems that the situation will continue to be like that as long as the Rafah crossing remains closed and as long as the ceasefire agreement as long as the ceasefire agreement isn't reached. And it doesn't seem that this is going to happen anytime soon.
Nizar, what do the medics say to you? I know you speak to them, you're talking to people on the ground every day in Gaza. What are the medical staff saying to you about their daily working lives now?
It's impossible for them to work in such an environment, actually. Basically, every health facility, every hospital in Gaza, and we're talking about 35 to be precise, they are all overwhelmed here. They are short on staff. They are short on medical supplies. They have absolutely no fuel, by the way. Even the UNRWA, the United Nations itself, just are saying today that they might be forced to shut down their entire operations within 48 hours if the fuel doesn't enter the Gazan enclave. And that doesn't seem to be happening anytime soon. The hospitals here are so overwhelmed that they have been using regular departments that are not allocated for the treatment of patients. For example, the pediatric departments here have been used to actually treat the critical cases here. They have been preparing hundreds of critical cases here, prepping them to be evacuated to receive more specialized treatment, whether in Egypt, in Turkey, or in any other country. But so far that hasn't happened. The list has been made in many hospitals, including this one, for example. This is Nasser Hospital, the largest in Khan Yunis. We know that it's been actually more devastating in other hospitals that are located in the northern areas. For example, Al-Shifa Hospital, they have been actually carrying out or performing surgery in the dock for the past 6 or 7 days because of the lack of fuel. I mean, hospitals itself have been targeted, evident by the fact Al-Ahl Al-Arabi Hospital, for example, was under attack a few days ago. Nearly 500 people were killed in that attack, and it has been very frightening for people to stay in there. Now, we know, for example, that nearly 1.4 million Palestinians fled their homes in Gaza City in the northern areas like Beit Lahia, Beit Hanun. They came to the southern areas following the instructions of the Israeli army, specifically to Deir al-Balah, Khan Yunis, and Rafah. And you have to keep something on mind, actually. These areas in the southern Gaza Strip only constitute one third of the space of the entire Gazan enclave. So basically 1.4 million, that's nearly 60 to 65% of the entire population of Gaza, are living in one third of the original space. That's how hard it is. Now, 540,000 people, for example, in the southern areas are staying in UNRWA schools that have become shelters, of course, because Gaza originally had no shelters. Many other people, for example, more than 160,000 people cannot stay in these schools. Even it's not just because they have no water, no food, no medicines. No, that's not the only reason. It's simply because they have no more room to stay in these hospitals. So they assume that it would be safer to stay in public places like hospitals. This hospital alone has more than 5,000 to 7,000 people seeking shelter right here inside Nasser Hospital. And that actually exacerbates the suffering of the medical teams here. They can't operate, not just because they're short on supplies and staff and everything, but because they're overwhelmed, of course, with the influx of patients that continue to come here. You can probably hear the sounds of these drones hovering all over the sky here. It's just an instance of what happens here on a daily basis. And the problem is the negotiations that are still underway in Egypt, for example, have not seen any actual breakthrough. Even the fact that some hostages have been released did not help in bringing in fuel. 4 shipments of aid reached the Gazan enclave through the Rafah crossing border, but these were all just basic medical supplies and some food aid and some coffins. That's what Gaza got. But the fuel, which is the main concern for people here, especially when it comes to the health sector, did not come. UNRWA itself had some reserves in one storage facility actually near the Rafah crossing. They got that 3 days ago, and it was only 6 trucks loaded with fuel, and it's almost finished now. It's almost done. So now UNRWA itself is saying that they will be forced to shut down in 48 hours. Now, if that happens, of course, the situation will be much more catastrophic. These people here, the medical teams, they rely on UNRWA and on the international community to help, because without these aid shipments, and we know there are still many others, we have at least 500 trucks loaded with fuel and medical aid shipment waiting in Al Arish airport. But the matter of these shipments entering Gaza is still depending on the negotiations, and there hasn't been any real progress there.
Nizar, when you speak to doctors and nurses, what's their morale like? How do they keep going mentally and physically facing what they're facing every single day?
Well, the term they keep using whenever we speak to them is a miracle. They keep telling me that some sort of miracle helps them keep going, actually, because one of the toughest situations that constantly happens here, and they keep telling us about this, is the matter of choosing who lives and who dies. That happens all the time here. For example, whenever they go to a scene after an air raid is carried out by the Israeli fighter jets, there would be many fatalities and many casualties. Of course, they suffer from a shortage of supplies. They don't have enough staff, and sometimes they are forced actually to leave some people in the scene because they know they can't be saved. So they choose to treat the ones that are most likely to live. or to survive. So imagine how terrible it is for a human being, not just a doctor, to make such a decision. That's what they keep telling us. The same thing happens here in the ER, inside the operation theater as well. And it happens all the time in all health facilities here in Gaza. We have seen that actually. We took a tour inside this building behind me, Nasser Hospital, in the operating room. And we actually saw how these decisions are made by these doctors. I mean, it seems that they have some sort of unprecedented courage, to be honest. But once the situation's over, once the incident passes, whenever they take a break, we can see some of these doctors actually holding each other and crying. That's how devastated they are. And they keep telling us about this. For example, a doctor told me yesterday he had to actually choose who lives and who dies 13 times in a single day. That's how terrible it is. One more thing is actually the fact that people here are unable to bury their dead loved ones. Not properly, at least, because funerals here can only last for 5 minutes, sometimes less, because large gatherings can be targeted so easily here in Gaza. I mean, it's quite clear that, you know, a large gathering, for example, would seem to be threatening for the Israeli planes, and that's why they have to make it quick. That means that they don't even have enough time to mourn the loss of their loved ones. And the doctors are actually part of this story. They are part of this process. They help the families. They take them to the morgue, which has been, of course, overflooded with bodies, especially today, for example. 25 bodies. We've seen that today in Nasser Hospital. And it does, now, what makes things worse, actually, is that it doesn't seem that the situation is ending soon, especially with Hamas and other groups continuing the fight. They say they're still convinced that this fight must continue. They still fire rockets. The Israeli army still carries out some very intense strikes everywhere. And this exchange of fire, which is insane, as people here describe it, is causing the loss of many hundreds of people here. Most of the people who lost their lives here are children, more than 63%, to be precise.
Nizar Sadawi, thank you so much for your courageous reporting. Stay safe. Well, let's meet our guests. In Manila, in the Philippines, is Christopher Gunes, a former chief spokesperson for the UN's refugee agency in Gaza, UNRWA. And in Hong Kong, Dr. Margaret Harris, spokesperson for the World Health Organization. Hello and welcome to you both. Margaret, my first question really is, how do you feel hearing what our correspondent on the ground has been saying in Gaza? Doctors and nurses choosing who lives and who dies.
Honestly, words fail me, but this is a choice no doctor or nurse should ever have to make. We're trained to save lives. We're trained to decide, to look at a patient, assess them, and decide what to do to fix them. Not to say, you can't live, you've got a better chance, I have to work on you. This is not a choice any doctor or nurse should ever be asked to make.
Chris, these conditions in Gaza are hellish. I mean, what's your reading of everything you've been reading and seeing over the last 3 weeks?
Well, you just asked Margaret about doctors making these choices. There are other parties involved in this conflict that have made choices. Hamas made the choice to go and commit the violations it made, which has appalled both the world and Israel. And Israel, of course, has made the choice to impose a blockade of Gaza since 2007, which has brought absolute desperation. There's 46% unemployment. This is the fifth Gaza conflict I have lived through, the fifth time, yet again, these appalling bombings. And it's much worse this time. 2,000 children being killed. Well, imagine if 2,000 children had been killed in Israel. So these are choices, yes, but they're choices being also made by member states of the UN, of the United Nations. And that's why it seems to be unconscionable that leaders like Rishi Sunak can effectively send the message to Israel that it frankly can do what it likes, even though they pay lip service to international humanitarian law. We're seeing an absolute violation on a minute-by-minute basis, it would seem, of violations of international law. And frankly, they have to stop. And if that were to happen, then doctors in Gaza would have the fuel they need to run their hospitals, would have the equipment and the medicines, and wouldn't be making these appalling choices.
Margaret, have you ever known a situation like this? I mean, the world is watching on, people feel helpless, and yet these courageous medics somehow find the courage to keep going every day.
No, in my career, I have not. And I've worked in a lot of very difficult places in very difficult humanitarian situations like Ebola in Democratic Republic of Congo. I was in Ukraine during the beginning of the war there, and in Afghanistan after the Taliban took over. But I've not seen a situation where doctors and nurses can't even get the basics and are in a situation themselves where they're all being killed. We're losing medical staff every day, either being bombed at home or in the hospitals. We've lost at least 16 killed on duty, and ambulance drivers and others. But the frustration they must be feeling, knowing that many of the things they're dealing with also are very complex injuries. You've got people with limbs very severely damaged and burns and horrible crush injuries. That takes a lot of effort, but they know they can save the people who've got those problems if they have the equipment, but they don't have that. To give you an example, one of our trucks did manage to get some supplies to one hospital. They opened the back of the truck and said, "Where's the anesthetic supplies?" and got out the anesthetic medicines and ran to the operating theatre because they were desperate to be at least able to do the operations with anesthetic, because until then they didn't have the anesthetic to stitch people up with.
Chris, we've heard stories of surgeons operating by the light of mobile phones because there's no power, using vinegar as disinfectant, using sewing needles to stitch people up. I mean, the lack of resources for people in the first world looking at this, working in the medical profession, they will be horrified by what they're hearing in Gaza.
It's absolutely horrific. And you're talking about the official PA, Palestinian Authority Ministry of Health hospitals. The other really huge service provider in Gaza is the United Nations Relief and Works Agency, alias UNRWA, that I used to work for. I hasten to add, I'm no longer their spokesman. I'm speaking in an independent capacity. But they are the only other service provider that can deliver at scale. And I'm just looking at the latest UNRWA update. 35 UNRWA staff have been killed since the 7th of October. Now, you can ask Margaret, I mean, any aid organization elsewhere on the planet, if 35 members of their staff were killed, they would withdraw from that conflict zone immediately. And yet, because UNRWA staff members are Palestine refugees themselves and part of that community, they have nowhere to run. Remember that Gaza is unique in the annals of contemporary warfare in being a war zone with a fence around it, with a wall around it. There is nowhere safe in Gaza. So UNRWA staff, 35 already killed, have no choice but to be there. And they will, as they've done through 4 previous conflicts, carry on working admirably side by side with the communities they serve. Not just members of staff being killed. UNRWA's update says that 600,000 internally displaced people are sheltering in UNRWA facilities, 150 UNRWA facilities. Now, most of these facilities are schools, and our schools they're there to give educations during the day to 1,000 students at a time. And you've got a situation where thousands and thousands of desperate displaced people are now filling up these schools, which are meant, as I say, for 1,000 kids. So the laboratory facilities, the sanitation facilities, the cooking facilities, the accommodation, it's totally underprepared. I mean, it was never intended to be housing this number, feeding this number, washing this number of people. So the sanitation conditions will be absolutely appalling. And of course, it's very clear that waterborne diseases and other communicable diseases are going to break out extremely quickly. So not only is the government health service being bombed, destroyed, starved of fuel and essential medicines, the other big service provider, UNRWA, the UN's Relief and Works Agency, they also are now on their knees. And already the 13,000 UNRWA staff had been evacuated south. The Israelis said, 10 days ago or so, they need to get out along with everyone else. But guess what's happening? The south is now being bombed as well. I've got friends in Nuseirat in the south. They were told to leave. They left their house in Gaza City. And a couple of nights ago, I spoke to my friends and they said, that over 20 tower blocks, residential tower blocks in their area, had been hit overnight. So, there's nowhere that is safe for ordinary civilians, non-combatants fleeing the fighting, but also the hospitals that are there to deal with them when they are hit are now completely non-functional. This is an absolute abomination in this day and age. This should not be happening. It's not a natural disaster. It's happening as a result of political choices, and political choices which are being egged on by Western leaders. And they ought to be utterly ashamed when they look at the consequences of their words. And I include Rishi Sunak in that.
Chris, thank you. Margaret, I want to look at the mental health picture for young people. We see so many harrowing injuries of children being brought to the hospitals that are still functioning. Talk me through the long-term impact. If they survive and they get fixed up physically, what is the long-term impact on their mental health?
The long-term impact of actually what's happening to all people right now is going to be deep and long-lasting. Just think, 15 days of no sleep. But not just no sleep, but this terrible uncertainty. You don't know where the bomb is. You don't know when it's going to fall. You may have already lost people. You can't even grieve for them because you're trying simply to survive. If you're one of the people whose function is to fix people up, like you're a health worker, or again, indeed, if you are somebody who's been injured, you are living this constant nightmare with no sense that you're going to wake up, with no sense that there's going to be any kind of relief, because we, as the relief agencies, are not getting any sense that those who could stop this, and I'm talking both sides, but those who could stop this don't seem to have any commitment to it. We've been calling for humanitarian access. We've been calling for an end to the violence from the beginning, and it's just fallen on deaf ears. The best, we saw a glimmer of hope when a few trucks got in, not nearly enough, nowhere near what the needs are, but that's the best we've seen. And just imagine exactly being somebody who has had severe injuries, who's lost family, who's in pain, whose horror goes on, and for whom the plethora of mental health services you need simply aren't there. The damage will be so long lasting.
In all your years of working, Chris, how bad is this right now?
Well, it's the worst it's ever been, and I've lived through 5 Gaza wars. And just to build on the excellent points that Margaret has just been making, if you've got a child in Gaza who's 15 or more, that child will have lived, this will be the 5th war. And what a friend of mine, a mother, said to me not long ago, is that with each war, the child is traumatized. So in the first Gaza war, the child is traumatized. In the second Gaza war, it's dealing from the traumas from the first one, and then the additional traumas from the second. With the third conflict, it's the first, second, and now the third war that's traumatized the child. With the fourth, the first, second, third. So this layer upon layer of traumatizing. There is a way around this. Although the Israeli narrative, which is we had terror attacks, we have the right to defend ourselves, although because the Israeli PR machine has gone into overdrive, headed by Mark Regev, the fact is that there is another narrative, and that is to look at the underlying causes. And so while this program has been important in looking at the dire humanitarian situation, I think it's also important to remind your viewers that if there is ever going to be peace between the Israelis and the Palestinians, the 3 underlying causes of this conflict must be addressed. First of all, the blockade of Gaza, which has had the most appalling, cruel consequences. The second underlying cause of conflict is the Israeli occupation, the Jewish settlements in the West Bank, which began with 1967 war. And with it now, you've got increased settler violence, settlers being protected since this right-wing, very racist coalition that we had before, the so-called unity government in Israel. And then very finally, the last underlying cause of the conflict, which must be addressed, is the dispossession of the Palestinians that took place in 1948. What we saw is the complete dislocation, the complete dismantlement, annihilation of Palestinian society. 750,000 refugees were driven into exile, and today they're living absolutely appalling lives in refugee camps in places like Gaza, incidentally. And we must address the underlying causes of conflict, because if we don't, you know what? In a couple of years' time, we'll be in an even worse conflict. And that, to me, is an unthinkable thought.
Margaret, my final question is to you. Just how do you even think about rebuilding a healthcare system like they have or what they had in Gaza?
We have to. And where you start is with those extraordinary health workers who are out there right now doing everything. You start with them, you support them, you recognize what they have done and can do, and bring them every level of support you can. And the most important thing we need to bring them right now is hope. They've got to have hope this is going to end. It should have ended already, but we must bring them hope. The world must bring them hope. Recognize what heroes they've been. They've stood for humanity. We are all humans. We need to absolutely say humanity will prevail, and we must go in there and do everything we can to support those health workers to rebuild, care for their population, and bring back something positive.
Margaret, Chris, thank you both so much for your insight. Remember, you can see more discussion and debate on our YouTube channel. Search for Roundtable TRT World. But for now, from me and Brady and all of the team here, goodbye and thank you for watching.